Hello everyone, this video is about dialysis. We will talk about the methods, process, and steps. One of the most devastating things happens in life is being sick of a major illness. Losing the function of any major body organ is fatal. But, few organs can be temporarily replaced by machines. One of this dreaded sickness is kidney failure, also known as end-stage renal disease, ESRD. This occurs when the kidneys lose their ability to function effectively, leading to the buildup of waste products and excess fluids in the body. The only remedy is to manually clean and remove the waste in the blood. The big questions are: is this the end of everything? Or any other option to keep living? If there is, how and what is the process to do that? Let's continue watching this video to find out how. The answer is dialysis. Now, what is dialysis? This treatment becomes necessary when the kidneys can no longer adequately perform their role in filtering waste from the blood. Dialysis is the primary treatment for kidney failure when the kidneys are no longer able to function adequately. Here's a summary of kidney failure requiring dialysis. Causes: kidney failure can result from various underlying conditions, including chronic kidney disease, CKD, diabetes, high blood pressure, hypertension, autoimmune diseases, genetic disorders, infections, and certain medications or toxins. Symptoms: symptoms of kidney failure can include fatigue, weakness, difficulty concentrating, decreased urine output, swelling in the legs, ankles, or feet, edema, shortness of breath, nausea, vomiting, itching, and muscle cramps. Diagnosis: diagnosis of kidney failure typically involves blood tests to measure levels of waste products like creatinine and urea nitrogen, urine tests to assess kidney function, imaging studies such as ultrasound or CT scans to evaluate kidney structure, and sometimes a kidney biopsy to determine the underlying cause of kidney damage. Now that you know the causes of kidney failure, let's talk about the treatment in details. Dialysis involves using artificial methods to remove waste products and excess fluids from the blood, maintaining electrolyte balance, and controlling blood pressure. Dialysis can be performed through hemodialysis or peritoneal dialysis, as described in the previous response. While dialysis can help manage kidney failure and prolong life, it's not a cure. Patients undergoing dialysis may need to adhere to dietary restrictions, take medications to manage symptoms and complications, and make lifestyle adjustments to optimize their health and well-being. Kidney failure patients are not allowed to eat foods high in potassium and phosphorus. Example of foods high in potassium are bananas, potatoes, tomatoes, avocado, orange, and more. Example of foods high in phosphorus are meat, poultry, some seafoods, beans, nuts, beer, and more. In some cases, kidney transplantation may be considered as a long-term treatment option. However, any transplant patient must take anti-rejection medicine all their life. This medicine prevents the natural antibodies of the body to attack the foreign organ. Now, dialysis can significantly impact a patient's quality of life due to the time required for treatment sessions, dietary restrictions, and potential complications. However, it also provides the opportunity for many patients to continue living relatively normal lives with appropriate management and support. In summary, kidney failure requiring dialysis is a serious medical condition that necessitates ongoing treatment to manage symptoms, maintain health, and improve quality of life for affected individuals. Dialysis works by artificially removing waste products, excess fluids, and electrolytes from the blood when the kidneys are no longer able to perform this function adequately. There are two main types of dialysis: hemodialysis and peritoneal dialysis. Here's how each type works. Hemodialysis requires access such as arteriovenous fistula, AVF, arteriovenous graft, average or permacath. Hemodialysis requires vascular access, typically created through a surgically placed arteriovenous fistula, arteriovenous graft, or central venous catheter. Alternatively, a catheter can be temporarily placed into a large vein, often in the neck or groin, for immediate access. This access allows blood to be removed from the body and returned after dialysis. Dialysis machine setup. the patient is connected to a dialysis machine that controls the dialysis process. Blood flows from the patient through tubing to the dialyzer, a device that acts as an artificial kidney. Filtration. Inside the dialyzer, blood passes through tiny hollow fibers. Surrounding these fibers is dialysate, a solution that helps remove waste and excess fluids from the blood. Waste products and excess fluids pass from the blood through the semi-permeable membrane of the fibers into the dialysate, which is then discarded. Return. The filtered blood is returned to the body through the patient's vascular access. The process is complete. Each session will last 3 to 4 hours. This dialysis process needs to be done 3 times a week. Dialysis machine setup. The patient is connected to a dialysis machine. Blood is removed from the body via the vascular access and passed through the machine's dialyzer, which acts as an artificial kidney. Filtration. Inside the dialyzer, blood flows through tiny hollow fibers while a dialysis solution, dialysate, flows outside the fibers. Waste products and excess fluids move from the blood into the dialysate through diffusion and osmosis. Return. Filtered blood is then returned to the body through the vascular access. In both types of dialysis, the goal is to mimic the kidney's natural filtration process, removing waste and excess fluids from the blood to maintain proper balance and overall health. Now, let's continue watching to see the other method of dialysis. Peritoneal dialysis. Access. Peritoneal dialysis uses the peritoneal membrane inside the abdomen as a natural filter. A catheter is surgically implanted into the abdomen to access this membrane. Filling. A sterile dialysis solution, dialysate, containing dextrose as the osmotic agent, is infused into the abdomen through the catheter. The solution remains in the abdomen for a prescribed dwell time. Dwell. During the dwell phase, waste products and excess fluids move from the blood vessels in the peritoneal membrane into the dialysis solution through osmosis and diffusion. Draining. After the dwell time, the used dialysis solution, now containing waste products and excess fluids, is drained out of the abdomen through the catheter and discarded. Cycling. The process of filling, dwelling, and draining is repeated multiple times throughout the day, either manually, continuous ambulatory peritoneal dialysis, or using a machine, automated peritoneal dialysis. Both hemodialysis and peritoneal dialysis aim to achieve similar results, removing waste products and excess fluids from the body, but they differ in how they access the bloodstream and carry out the filtration process. The choice between the two methods depends on various factors, including the patient's medical condition, lifestyle, and preferences. The only permanent solution for kidney failure is kidney transplant. After finding a matched kidney donor, a meticulous and delicate surgical process is performed. Once the surgery was successfully performed, the patient needs to take a medication called anti-rejection medicine for life. I hope this video helps you to understand what is dialysis. Please like and subscribe below. Thank you.